Okay, hello, this is Dr. Hummel Price, PGY2, over at NHS Tahlequah. Today I wanted to discuss our project. So we decided to tackle a problem that's been affecting our patients and length of stay. We looked at whether or not increasing patient mobility and different ways that we could affect that as well, increasing orders, changing order sets, things like that to reduce hospital length of stay. Obviously, early mobilization is very important in mitigating short and long-term consequences associated with extensive ICU stays. There's been a lot of research done in this area. Even if they're relatively sick, you can start it relatively early. It's been shown to improve outcomes and get patients out of the hospital faster, especially get them in places where they require less attention from nursing or family in that respect. So instead of having to go to, for example, like a SNF, they might be able to get away with like a short stay at rehab, or going home with home health versus going to a rehab or SNF, etc. It also improves delirium, functional recovery, etc. So overall, for our aim, we tried to reduce ICU length of stay by ensuring over 70% of critically ill patients engage in mobility activities during more than 75% of their hospital stay. This graph in particular probably shows that better than other things. So what we have here is length of stay in days on the y-axis compared to mobility activity physical intensity, which is essentially a patient score that we devised to kind of calculate how much activity a patient was doing. So the less activity a patient would be doing, such as just getting up in bed, dangling legs off the side of the chair, would have relatively low points associated with them. But things like getting up and walking the halls had much more points associated with them. So that would, more points would be over here, less would be over here. So the first graph up here is from July 24th to December, July of 2024 to December of 2024. As you can see by the slope of the line, there isn't really much of a relationship between the two. We haven't really focused much on it. And then once some of these projects started, both the resident side, which was again expanding order sets, specific activity levels, trying to avoid things like just rote clicking of bed rest, and then providing bedside education to the patients, getting involved with nursing to improve and kind of encourage ambulation. And then we tracked participation pretty thoroughly using things like AMPAC scores, and then we measured the overall participation, and then we also had interdisciplinary team meetings between us and nursing, even at the more executive level, to try and improve mobility. So and then down here, from January of 2025 to present, so that's whenever all those initiatives started, you can see a clear improvement. The better a patient's mobile physical activity score was, the sooner they were able to get out of the hospital, decreasing healthcare costs, improving patient outcome, improving their quality of life. Furthermore, so we were looking for our goal is to get greater than 75% of total patients participating in mobility activities, and we're still working on getting to that metric. But as you can see, regardless, we are seeing an improvement already. So that is essentially our paper, our topic. Thank you for watching. We look forward to expanding this project a little bit more, see how we can also improve mobility versus disposition to home, whether or not patients with better mobility scores are able to go home, and then whether or not patients with better mobility have less readmission rates, and then their actual functional status at discharge, whether or not we're able to improve it substantially compared to admission. and we'll also look into teasing out a little bit better the resident-only metrics versus nursing metrics. So a lot to come, but the baseline result is essentially that we saw an improvement in with decreased length of stay with increased activity. So thank you for listening.